Welcome to the third video in a three-part series for caregivers and professionals, sponsored by the New York City Department for the Aging, DFTA. DFTA provides referrals and information for professionals and caregivers using a network of community-based agencies that focus on the care and well-being of a diverse population of older adults. In this video, professionals and caregivers will learn about the CARE Act, the New York State Paid Family Leave, and information about the types of respite care services available by calling DFTA. You will learn how important it is for caregivers to get the right information and how to learn more about a caregiving situation by asking relevant questions while maintaining empathy. You will meet Shelley, 63, a retired teacher, and her husband Mike, 60, who works full-time. Shelley has heart surgery in a month, and they are overwhelmed. Mike sees the 311 caregiving support advertisement on the subway, and together they decide to call DFTA representative Will.
Hello, you've reached the New York City Department for the Aging. My name is Will. How can I help you?
Oh, hi, Will. I'm Mike from Brooklyn Heights, and I have my wife Shelley with me. We were wondering about this subway ad we saw about caregiving support.
I'm glad you called, Mike. The ad is to help people realize that help is available. Tell me a little about your situation.
Well, actually, it's for Shelley. She's having heart surgery in a month, and the doctor told us we need a home care plan or something like that. We don't know anything about this kind of thing.
I understand. You're on a journey that you've never been on before, so how would you know, right? Let me see what we can find out for you.
Exactly. Our only daughter lives in Florida, so she can't help, and I'm still working full-time.
Well, it sounds like you may need some support to get things ready before Shelley's surgery, and once she gets home to recuperate. Is that correct?
Yeah, the doctor told us she'd be healing for 3 months. How am I going to get that kind of time off from my job?
There are a few things we can try. Mike, have you heard about the New York State Paid Family Leave? It can give you up to 10 weeks of job-protected paid leave to care for a family member.
No, I haven't. I'll talk to my HR person at work about it. Thanks.
You're welcome. The other thing that may be good is to have home health care in to help care for Shelley once she is at home.
Oh, I don't make the kind of money to afford home health care.
Would you be open to exploring some options for paying for home health care? In most cases, Medicaid or your health insurance plan may pay for all of it or most of it.
Yeah, sure. Why not? I've worked in the city for 20 years, so they can do something for me now.
Another option you may find helpful is respite care, for times when you need someone to stay with Shelley for a few hours so you can grocery shop, run errands, and take care of other things.
I never even thought about that.
One more question. Has Shelley designated you as her caregiver proxy yet?
We talked about it with the doctor, but I'm her husband, so is that necessary?
Have you heard of the CARE Act? It requires all hospitals to record the name of a family caregiver before a patient is discharged from the hospital. Make sure they give you a form to sign and instruct you the care that Shelley will need once she is home.
Thanks a lot for this information, Will.
My pleasure. I will be back in touch in a few days with more information, and you may receive a call from one of our partner agencies in your area. Is that okay?
As you can see, the DFTA representative, Will, used a series of questions and an understanding tone to learn more about the caller Mike's needs. Will reflects the concern that Mike had about taking time off from work, while providing him with additional information and resources that could help him manage the unfamiliar role of caregiver. Will also used phrases like, "We can try," and "This is a new journey you've never been on," to reassure the caregiver and make him feel at ease. It's critical for caregivers to not feel judged because many are already fearful, frustrated, and feel uneasy about asking questions. Use compassion and build rapport. Get as much relevant information as possible, but do so by building trust first. Use a calm approach. Make follow-up calls as needed. This is especially important if there is a crisis. If there is suspicion that the patient is being neglected, abused, unintentionally or intentionally, or if anyone is in any kind of immediate danger to himself or others. The CARE Act was passed into law in 2015, requiring professionals at hospitals to record the name of a family caregiver on the medical record of each patient, inform the assigned caregiver when the patient is to be discharged, provide the caregiver with education and instruction of the medical tasks they will need to perform for the patient at home. Going the extra mile for patients experiencing life-changing events is what the CARE Act promotes. Professionals should always take the time to explain the CARE Act and the New York State Family Paid Leave while demonstrating empathy for caregivers. When patients and their caregivers feel supported and receive the education and information needed, the transition from hospital care to home care goes better and reduces the number of emergency room visits and repeat hospital stays. DFTA can provide access to a wide variety of respite care services for eligible New York City caregivers, personalized to meet the needs of caregivers and their families. Respite care may include part-time, in-home care, adult daycare, or overnight stay in a skilled nursing facility. This is beneficial for caregivers who need a break and to take care of their own emotional and physical needs. Respite services are one of the core services provided through the DFTA-funded caregiver programs. By educating and empowering caregivers, DFTA can help create positive outcomes for both patients and caregivers. Coming up next, you will hear from several professionals who have focused to support older adults and their caregiving families. You'll also meet caregivers who have benefited from caregiver services.
The Caregiver Resource Center is a team of social workers that respond to service requests for information by the public. It could be an older adult, a family caregiver, or a professional seeking information about services for older adults. We discuss options with individuals regarding services out in the community and make the needed connections in order for people to have their needs met. The Caregiver Resource Center serves all in New York City. We have staff that speak different languages in order to meet people's needs. And we also fund caregiver programs that are out in the community to help family caregivers navigate the caregiving world, what it is to be a caregiver, and plan accordingly to be able to meet the needs of the person that they're caring for. And Respite is really providing a break for the caregiver so that they can have a break in their caregiving responsibility. Often, without that break, they can burn out. The caregiver can become depressed, they can become ill themselves, and so Respite is really one of those services that's very necessary for the well-being of both the caregiver and the care receiver. And Respite can look like many different things. It could be a home health aide in the home. It could be the care receiver going to a social adult day program to engage socially and participate in activities. It could be a stay at a skilled nursing facility because perhaps the caregiver just needs to sleep or has to do out of town travel, or they need to have some sort of medical procedure. So Respite can look like many things.
Well, I think when you're talking to a caregiver, the most important thing is to let them talk, let them listen to them, let them tell their story, and don't interrupt. Give them as much time as they need to explain the stressors, the problems, and as they're speaking and as they're presenting their story, write down key information that you're hearing from the caregiver. If they're giving you names, telephone numbers of other agencies, of other people that have been trying to assist them. Write these things down, and then when it's your turn to talk, try to incorporate that into the dialogue so that it doesn't seem like you're doing a Q&A with them, but you're having just a normal conversation. Because the most important thing is you want to keep the caregiver calm and make them feel like you are there to assist and that there's no judgment and that your role is to be a helper. We have a tremendous resource base, and so as we listen to the caregiver, we begin to start thinking, okay, what are the services that this individual needs? We have computers at our desk. While the caregiver is speaking to us, we could be Googling all kinds of information to prepare to give to the caregiver. Or we have the information in our own, favorites, in our computer. And so by the time they finish presenting their issue, we have a whole slew of options that they can choose from. It depends, on their financial situation, on their health situation. What many caregivers won't accept many of the services that are available to them. So we then have to compromise and find another route to go down or around.
A kinship caregiver is someone who is caring for a child that is biologically not their own, who's taking on the primary role to care for someone to make sure that they're provided the basic needs and whatever. It could be a grandparent who's raising a grandchild. It could be someone who's raising their brother, a niece, a nephew, a godchild. It's primarily someone who, like I said, is taking on a role that was given to them, could have been, through death, a variety of reasons, but who's now caring for them. There are so many challenges that our kinship caregivers face. A lot, mainly finances, not being able to financially provide. Most of our kinship caregivers, grandparents in general, are on a fixed income. They're making below $20,000. And so that has been an issue in terms of how they're now providing for the care of this child or relative that they're caring for. In addition, there are huge housing issues which cause, space and, whether or not this is suitable, if we can manage this. Now we have another child in the house. Is the child getting any source of income if they come through another source such as kinship care, substitute guardianship, and a variety of other things. So housing issues are a big thing. In addition to that, advocacy, case assistance, support. What do I do now? I have this child, I have this person I'm raising. Where am I going to go with that? So navigating in these systems, all of those things are big challenges.
Kinship caregivers face a lot of challenges, and I think a main challenge is for a lot of kinship caregivers is that they don't realize that they're going to be kinship caregivers. Many kinship caregivers happen to become kinship caregivers at the last minute without even realizing it, usually by a social worker. In New York City, it's usually the Administration of Children's Services coming to their door, informing them that their children are under the care of the city and would they take them. And that is one main issue. Other issues are definitely financial issues. Again, they're not expecting it, and so all of a sudden they have whether they're working or whether they have a pension or Social Security, now they need to look for other resources to buy additional food, buy additional clothing, and everything else that comes along with having children.
I became a caregiver. It's basically a long story, so I'm going to try to encapsulate it, but it really goes back to 2004. That was the seminal year, unfortunately, when my mother had a stroke, and that left her with a right hemiplegia and very limited mobility on the right side. Because she's a former occupational therapist, she definitely adapted and learned how to write with the left hand. So in those early years, I was really backing up my father. My father was the prime caregiver for my mother. And then over time, the stress of caregiving and the aging process took its toll on my father. And unfortunately, we lost him in 2015. Mom was still fairly independent at that point, so I was still living uptown. I own a condo in Harlem. And I was still, kind of going back and forth. But unfortunately, in 2016, my mother fell. And when she got out of rehabilitation care, they said, okay, she's now in need of someone to be there when she gets up to use the bathroom and so on and so forth. She cannot be alone in the apartment by herself. And it was that point I decided that it was time to lease my apartment uptown and move with my mother. And so since 2016, fall of 2016, I've been with my mother. The reason why I started reaching out to DFTA is that what I was initially looking for was respite care. Because I realized after 3 years of living with my mother, even though, we get along well and, just the toll of caregiving was starting to get to me. I got to the point where I felt like I was pulling my hair out and, I had given up the idea of going away and I just never gave myself a break. So I started researching respite care, and I found the DFTA office. And I called and I spoke to the social worker there. And the wonderful thing was that she left me 2 messages because I contacted the office online. And when she couldn't get me the first time, she actually took the time to call me back. And I was, wow, you're calling me back. It was pretty amazing. And then when I started to describe to her what I was doing as a caregiver and that we didn't really have any outside help, and from the insurance standpoint, we're not on Medicaid, so we're not eligible. We were paying for home care out of our pocket. So she said, well, what kinds of things do you need, and what do you, and she said, everything I mentioned, she goes, oh, we could help you with that. When I talked about what my mother needs for personal care, oh, we could have been helping you with that, she said. And so I became so excited. So she was the one who referred me to PSS Circle of Care, and their social worker came and met with us, and it's been a dream ever since, because what they were able to provide for us was basically coverage for home care for the month of April, since our previous aide had left, and the ones that we knew from the building, didn't work out. So they really saved us by providing us 1 month of interim care until we could find someone that we could use on a longer-term basis, or employ on a longer-term basis. And then they've been helping us with the material needs. I remember we got several boxes from Amazon, and I initially thought, I said, oh, Mom, I didn't order anything from Amazon. They didn't, this must be a mistake. And when I opened the boxes, it was the wipes, it was the, all the things that we had requested, and it was like Christmas. We were screaming, saying, oh my God, So it's really been wonderful to have the interim respite care and the materials, and I just feel so supported.
In this lesson, you've learned what professionals and caregivers need to know about the CARE Act requirements, New York's paid family leave, and how professionals can best help caregivers.